afternoon, everyone. My name is Deidre Reese. Again, I'm a regional health officer with Cook County Department of Public Health. These are our weekly COVID-19 school calls. Many of you may have participated in this meeting some time ago. We've been doing these throughout the COVID-19 response. We recognize that everyone has questions. This is our way to get information out to the school community because we are not able all the time to talk to each individual school. So if there are others within your school building that you think need to participate in the meetings, please be sure to invite them. These calls are held each Friday at 2:30. Today is the first we've had in a while, in about a month or so before school let out. A few things about our meeting today. Basically, the objective of this meeting is to provide updates and support to schools while navigating COVID-19. It's also to address frequently asked questions. Oftentimes, if one school has a question, someone else also has that question. So we're doing our best to get those questions answered for you. And then also to provide contact information and resources to you all related to where you can find information, get information, latest happenings. As you all know, things are constantly changing within this pandemic. And so as things change, we're using this as a means to share information with you. Some of you all may have noticed a difference in our call today. The chat is not open right now. We will open the chat later on during the call, but we just would like to try not having the chat open because oftentimes that kind of distracts from our presenters. We will open the chat a little bit later. In addition, many of you did submit questions prior to the call. Those questions have been forwarded to our team and we're working to address answers to those questions. Some of those questions will be addressed in today's call. And as you have questions, you will be able to continue to send those questions to the COVID-19 email, which I'm going to share shortly, and you can continue to get those questions answered. If we aren't able to answer it during the call, know that we are sharing those with our team and trying to come up with ways to make sure that we have those questions answered for all of you. Some important announcements. So specific things, the COVID-19 email is listed here. ccdph.covid19@cookcountyhhs.org. That is where if you have questions that you want us to answer on this call or something has come up during the week, it's a general question, please send those there and we will make sure that you get the answers to those questions and that we forward it to the appropriate Cook County Department of Health staff. We also have our Cook County Department of Public Health website, which is listed here, and we also have a schools page, and ideally we are building this page. We just recently updated the page. The purpose of that page is really for any information that you all need related to schools, any guidance, you want to do an event, you want to get do testing at your school, you want to report cases. All of that information can be found on our school health page of our website. So I would encourage everyone, when given an opportunity, to please take some time to check that out so that you can know where and how to contact Cook County Department of Public Health. There's also the vaccine website. We'll talk about that a little bit later. And then we also have our vaccine communication tools related to things related to COVID-19, flyers, posters, tweets, different kind of communication tools. So please note that there is a section on our website that includes that, and you're welcome to use those for your school or for your events or just in terms of promotion of vaccine. I also want to note that since our last call and the last time we met, we spent a lot of time last year talking about our mass vaccination sites. As you all know, we had several of them throughout Suburban Cook County. As of right now, outreach is changing in terms of the pandemic. There are no longer mass vaccination sites open. So just so that you are aware, we had sites at Tinley Park, Des Plaines, and other places, South Suburban College. We had one at Triton for some time. All of those sites are now closed. So just want to make sure that everyone is aware that all mass vaccination sites are closed, that we are moving now to what is being termed the hyper-local strategy, which really is about meeting people where they are, hosting events in communities, at locations where people already go or are likely to go. So you'll be hearing more about the hyper-local strategy and things like that. We also have some target communities that we're doing some extra special outreach in. So we'll be wanting to get your input and participation on that as well. We just want to make sure that everyone was aware that all mass vaccination sites are now closed. In addition, we also use this call to share other information with schools within the health department. Many of you all know that at the health department, particularly for our school nurses, we do give out standing orders for EpiPens. Our previous contact for that was Keith Wynn. Keith Wynn is no longer coordinating EpiPen requests. Those requests are now being coordinated by Kelly Jones, whose email is listed here. You can email her directly, or you can go to the COVID-19, and that's for school nurses. Some nurses have already done that. If you need a standing order for EpiPens, Kelly Jones is now the contact. Kelly is usually the host for this call. However, she's on vacation this week, so I'm sitting in for her. I want to tell you, I just mentioned that we have some very specific hyper-local strategies. While our goal is, of course, to get as many folks vaccinated in suburban Cook County as possible. We do have a project right now where we're reaching out specifically to the communities listed on the slide: Burnham, Calumet City, Dixmoor, Dalton, Fort Heights, Harvey, Markham, Phoenix, Riverdale, Robbins, and Sauk Village. If you have schools in that area and you're interested in partnering with CCDPH around vaccine events in those particular areas, please reach out to us at the email provided, ccdph.covid19@cookcountyhhs.org, and we will have somebody from our team to get back to you. We really want to make sure that everyone has access to vaccine, and those in some of our hardest to reach communities, we want to make sure that vaccine is available to them. So if you serve those areas, please reach out to us and we'll get back to you. We're working with you around how we can get more people in those areas vaccinated. While this is just one project of CCDPH, of course, we also are working with others throughout suburban Cook County in order to make sure folks are vaccinated. Next, does your school have a COVID-19 testing program? Our communicable disease team has this survey. I'll also make sure to send it out after the call as well. We really would like you to fill this out and let us know if you have or currently have a COVID-19 testing program. We please ask that you fill out the survey. It'll be very useful to us so that we understand who has COVID-19 testing programs. In addition, some of you may still be interested in the Buy Next Now COVID-19 testing kits. We are still giving out those testing kits to applicable schools. So the information is listed at the bottom of this slide. You can find that information on our website on the school page as well. So if you're interested, we do still have Buy Next Now testing kits available. And so we do ask that if you're interested in that, to please check that out as well. That is another resource that we have for our school community. In addition, oftentimes we know that people, schools, organizations are having events. You're looking for speakers. There is a speakers bureau available. You can fill out this form. And again, like I said, all of this is on our school page, but if you need a speaker for an event, please fill that out and someone can get back to you about availability for someone to come out to speak related to COVID-19. We also have and understand that there are some people that may have challenges with getting to a COVID, getting a vaccine. We still also have the mobile strategy geared at those 65 or older or disabled, where they'll come out to the home to actually give COVID-19 vaccine, but there is criteria that does apply for that. In addition, I'm going to let our speaker speak to this more, but if you also are interested in having vaccine at your school, you don't have a provider, you want to have a back to school event, or you're planning a back to school event and you would like to have a provider, we ask you, we can hook you up with a provider to come out. You can email us at the COVID-19 email that I listed before, or we have sent this out to all of the schools. You all should have this. We can resend it again. It lists information about how you can go to Cook County Health site, work with Cook County Health, or with us around hooking you up with a mobile provider. But we can send that out again at the end of the. So I want to thank you guys for listening to me. I'm going to turn this over to Lex, who's going to take it from here with her presentation.
So for those of you who don't know me, my name is Lex Berta, and I'm an epidemiologist and CDC fellow at CCDPH in the Communicable Diseases Department. I've talked to a lot of you before, but for those I haven't spoken to, welcome to the start of this school year's webinar series. I'll typically be covering communicable disease topics and going over COVID guidance. The presentations that I give are sent out usually on Monday or Tuesday after the webinar, so if you're worried you're going to miss something on the slides, don't worry, they will be sent out. So without further ado, this is the agenda. We've got, I just want to mention a lot of the guidance that you guys might have questions on will be addressed next week once IDPH comes out with their new FAQ for schools. So a lot of more particular things will be addressed next week, but we will talk about a few updates. And those were largely mentioned in the press release, and I took a quick Google to get that link. So if you can't wait till Monday or Tuesday to get it, it's super readily available out there. Then just some reminders. Oh, it looks like this rendered a little weird, but we're gonna just remind everybody how to actually report cases and contacts, and then talk about how to set up infrastructure for testing in your schools. I'm going to address masks in school settings. That's kind of the guidance we're going to talk about this week. And then kind of asking for your input. What topics would you like us to address in future webinars? What would be most helpful for you? Because usually we just kind of go off of the kind of communication we've gotten. Like, oh, someone's asked this question like 4 times. Maybe we should cover it. And then, of course, we had some questions submitted. So first, the email for COVID in schools is up on the screen. Send them, cases or any other information you have, questions. When you do email about a specific situation, please give us as much information as you possibly can, full names, date of birth, any dates that you know of, like when someone's symptoms started or the day they were tested, or if you have access to the days that they were vaccinated, that would all be really helpful. So that is our kind of catch-all new school email. And then we also updated our webpage to hopefully be much more easier to navigate. It's designed to be kind of a one-stop shop for all of your school COVID needs. There's a link to where you get the data from to look and see like what our transmission level is. There's guidance linked, organized by organization and topic, access to the instructions on how to report cases, also links for vaccination sign up, including if you want to have vaccinations at your school, and then testing requests as well, and also links to get CLIA certified. So that is all there. Hopefully it is really comprehensive. We spent a lot of time trying to brainstorm how to redesign it this summer. So take a look at that. When the chat is turned on, I can put these links and the school email in the chat for you guys. Okay, so this is just a refresher on reporting school-related COVID cases and contacts to us. It's the same line list spreadsheet that most of you are familiar with. It's available on the school page, and you'll fill it out and return it to that school email. We ask that if you have multiple cases or maybe a couple have popped up at different times during the week, please highlight the new entries in the spreadsheet so we know who's new and that who hasn't been addressed yet. And then the only cases right now that need to be reported are confirmed cases. So there's a laboratory report that usually we're able to get a hold of ourselves, but we need to be notified that they're connected to a school. Probable cases, which you know somebody has been exposed by somebody who you guys have known to have COVID, and now that person is sick. And then close contacts, which is a bit of a trickier definition than it used to be, but generally within 6 feet for a cumulative period of 15 minutes over 24 hours to a confirmed case when masks are not worn and that contact is unvaccinated. We'll talk a little bit more about this because we had some submitted questions. And then basically this is just a list of the kind of information we're hoping to get for each of these cases where you would report to us. So just going over the line list, each row corresponds to a person, whether they're a case or a contact, who is somehow related to your school, either student or staff or I guess a visitor who accidentally exposed people in some capacity. So basically you just give us the date you're contacting us, so we have that in writing, and then the name of your school and your district, what that category of person is, whether they're student, teacher, staff, coach, things like that. Whether they're a confirmed case, a probable case, or a close contact, their full name, it's okay if you don't know middle, but their date of birth. You'd be surprised how many people have the same names, so that's really important if you can give that to us. Home address, cell phone of parent or guardian if it's a student, email address, and if it's a student, that would be email address of the parent or guardian. Where the exposure took place, if you know that, the last day they were actually in person, and the date they actually got exposed, if they have symptoms, if they've been tested, what was the outcome of the test and when did they get tested, if you know what type of test was it, and if it was an antigen test, please let us know if you know the location, because sometimes those reports don't go through our lab system right away, so we have to actually call the facility. Whether they were hospitalized, what kind of setting the exposure took place in, whether your school policy is that they're going to need a release letter and not just a date from the health department. And then if they know who they were exposed by, that person's name and contact information, any kind of notes, and then we will return a release date to you. If you're reporting a close contact, please put information on the case that contact was exposed to the greatest extent possible, because sometimes we need to follow up about different settings that had possible exposures related to the one that you have reported to us. And then just the most important thing is give us as many dates as you possibly can. So that's just a refresher. And then this is on setting up testing infrastructure in your school. I know plenty of you attended the SHIELD presentation at the end of the last school year. So as a reminder, if you want to perform tests in schools, you need a CLIA waiver. Got a link on here to fill that out. It's sometimes takes a little bit to process, but honestly, I've heard some good feedback that things have been processed pretty quickly during the pandemic. So once you have your CLIA waiver, you can request tests from us and IDPH. SHIELD tests are available and Binax tests are available. And SHIELD is a saliva test that is PCR, so that's a pretty vigorous test. And then Binax is an antigen test, so a little less accurate, but still a really good test. And some options for you, if you did want to set up testing infrastructure in your school, is to set up a screening program where you have a certain amount of students or staff who are unvaccinated. Vaccinated people don't need to participate in this. Get tested once or twice a week, or you could just set up a screening program for your high-risk sports teams. And that's just something that occurs on a regular basis. Or And or, in addition, you could have a test to stay program. So in certain circumstances, a student who doesn't have any known exposure to COVID can take a rapid test at the nurse's office, and if they feel well enough to go back to class, return back to class if it's negative, if, you know, the circumstances are right and transmission is low. So those are some options that you could set up. It's highly encouraged, but I do know that is a big burden of work for schools to go through. So we are here to help you along with that process. And then we'll pop this link in the chat. But again, please let us know where your school is at for your testing infrastructure and if you have any hope in setting it up or need extra help with that. Please let us know. We're just trying to gauge whether it will be feasible for us to create guidance based on people having a testing infrastructure in their schools, or if there's just not enough people to make that useful for the county. All right, this is the big question. I think everybody's minds have been on it. We at CCDPH support the CDC guidance that IDPH has adopted, and we support the AAP guidance. Masks should be worn by all unvaccinated individuals aged 2 and older while indoors in the school setting. It's really important, obviously, unless they have a medically documented reason why they cannot be wearing a mask. And I do want to clarify, the language at every level says should, but should does not equate to optional here linguistically. It's the same as how we should wash our hands after we go to the bathroom. It's a very high recommendation, best practice. This is what should be happening. That doesn't mean optional. So we even encourage schools to take the stricter approach depending on what they are comfortable with and what the community is comfortable with, to follow the AAP guidance, which is to mask anybody who can medically tolerate wearing a mask, regardless of vaccination status. So for unvaccinated people, they really should be wearing a mask. For vaccinated people, it's still a good idea. And we would be in full support of any school that wanted to take that more conservative approach. And as an addition, pending where we're at with community transmission, especially getting into flu season later this year, this may become the recommendation for everybody. We will see, knock on wood, where we're going, especially with the Delta variant. And then I do want to mention shortened quarantine options and being able to relax distance in schools will require masking. I think IDPH should be out with their FAQs next week, being more specific on that, but those they're not really special privileges, but things that will make your life more flexible in the school setting will require masking. And I just want to let you know the CDC brief on masks is really good and comprehensive. Masks have been proven to protect the wearers and also control the source if someone is infectious. And studies have shown that there's no change in oxygen or carbon dioxide levels while wearing a cloth mask or a surgical mask during rest or physical activity. I know they're uncomfortable. I know my partner's kids in his classroom fall asleep sometimes when it's too hot with a mask on, but there actually isn't any change in breathing ability here. So that is some very solid science. And this is CCDPH's stance on mask wearing. And then kind of my last question here is, what topics would be the most helpful for you and your schools? We don't want to waste your time on Fridays, and we want to be as much help as possible. So just through some examples on here, like, would you like to expand on what mitigation measures are appropriate and under what circumstances? Would you like us to expand on the role of CCDPH in schools and enforcing public health measures during a pandemic when the goal is to have everybody in school? I could certainly cover the science behind masking and vaccinations and give suggestions on how to respond to any false claims or genuine questions and concerns that parents have. Certainly can go over data. And also, I know there's so many vocab words in this pandemic. So if you guys want a refresher on definitions for things, we can certainly do that. And then also, I would like your input on whether it's easier for you guys to have mitigation measures that can be changed based on following metrics for the community, or if a blanket sweep, this is the best practice for everybody, regardless of what's going on in general for the community, if that's easier for you guys to follow. So just some examples. If there's anything else you guys want covered, or there's something really specific to your school, you can certainly email us. But when the chat gets reopened, please pop your ideas in the chat. We want to get to as many of your things as possible in the next couple of webinars so that you guys can be prepared for the school year. All right, and lastly, just going to go over the submitted questions. First one, do we need to do daily self-certification? I've gotten this a couple of times, and the answer is daily screening is no longer recommended, and if you need documentation, you can find it on that ISB document. I mean, as per usual, everyone should just be personally monitoring their health and really staying home when they feel sick, but studies have been done, and self-certification wasn't found to be the most effective mitigation tool. So that is not a requirement. Next question, can you confirm that we can ask staff for proof of vaccination? Can you confirm that we can ask parents regarding student vaccination status? And the answer is absolutely you can. It is not a violation of HIPAA or FERPA. We do this routinely for other vaccines. If a visitor is not vaccinated or is unwilling to share that information, they should wear a mask in the school setting. So hopefully that helps you guys out. Third question, can you confirm that vaccinated staff or students who are close contacts of someone with COVID-19 and are exhibiting no COVID symptoms do not need to quarantine or get a COVID test? And that is correct. Fully vaccinated staff and students who do not show any symptoms do not need to quarantine or get tested. If you've got, let's say, a sibling who's old enough to be vaccinated and got vaccinated, but the younger sibling wasn't old enough, so they're unvaccinated and become a COVID case, that older sibling doesn't need to be sent home from school, is where I think that's pretty applicable. We've got a lot of submitted questions, so bear with us. For non-vaccinated individuals, can you confirm that the close contact definition is now within 3 feet, not 6 feet? So it is getting to be a little bit more complicated of a definition. So specifically in the classroom setting, so not like the lunchroom setting or outdoor for recess, the close contact definition is within 3 feet, but with the caveat that there is consistent and correct use of well-fitting masks. If masks are not being worn consistently just because of children's age, or they're not worn at all because masks are optional and people are choosing not to, the close contact definition is within 6 feet. And as always, it's cumulative over 15 minutes for 24 hours. Can you confirm that unvaccinated students can go without masks outdoors if it is not a crowded setting and does not involve sustained close contact with others? This should be fine, but you really need to be closely monitoring this situation and ensure that close contact truly isn't going to happen. We're seeing a lot more kids getting the Delta variant, so we have to be pretty vigilant here. Questions are coming up if there is a limit to how many students can be on a bus and if there are recommendations on spacing. And I just want to say that IDPH will be releasing more detailed bus guidance shortly, so stay tuned for that. Will CCDPH require monitor testing and masking to implement the 3-foot definition of social distancing? So masking is absolutely required for that 3-foot definition, but screening testing is not required if community transmission is low and staff-student vaccination rate is pretty decent. So screening testing is always a great idea, and it gives you more flexibility for your mitigation measures, but is not a requirement in this situation. Will the definitions for minimal, moderate, and substantial transmission remain the same? I popped up the definitions on the screen. You can access that on IDPH and CDC's guidance. What recommendations are there for locker room use? And I believe that should be addressed in the next IDPH IHSA update, which should be coming shortly. What are the mitigation recommendations for athletes? Again, that more specific stuff will be coming shortly, but for high-risk sports that are contact, that are happening indoors, like basketball or football, since there's just so much contact in football, it's recommended for them to undergo like a regular screening. And you can find that guide at the link provided when this gets passed out. And those were the submitted questions. So I'm going to stop sharing and start to take a look at the chat and hit up some of those questions. Before I do take a look at the chat questions that have been submitted, though, I want to put in the survey link for whether or not your school has any kind of screening program in place or what you're doing with regards to testing. I'll also pop in the updated CCDPH website and the new CCDPH email for schools to email for COVID questions or reporting cases. And if you haven't read it yet, here is the new CDC guidance for schools, and you can access the CDC data tracker here, and you can access our CDC or our CCDPH data tracker here. Okay. And then also,
thanks. We'll make sure to share all that too after the call as well.
Okay, great.
Just a concern. We'll make sure that we share it, send it back out.
And then this last link I'm sending is our recent press release for COVID mitigation in schools. First question. In the CCDPH guidance, physical distancing of 3 feet is noted as should be implemented in the classroom whenever possible. What about other settings such as while eating lunch, PE, recess, hallways, music, band? Oh yeah, snacks often eaten in the classroom. Is 3 feet okay in all of these other settings too, or is 6 feet needed outside of the classroom? This is a great question, and we've talked about it a lot this week. Obviously, we want to distance as much as possible whenever possible, to 6 feet being the goal in like lunch, PE, in the hallways. 3 feet as a close contact definition is specifically for the classroom setting, for mask wearing. So someone who's within 6 feet in those other settings, like when masks are off and people are eating lunch, are going to be considered a close contact. So for lunch, you probably want to do assigned seating or make sure you're just keeping track of where people are sitting every day. So the definition changed, but we don't want distancing to be a limiting factor for kids returning to school. So we recognize you might not have the space to have people 6 feet apart. Just do the best you can in these situations and know that outside of the classroom, those people who are within 6 feet would be considered close contacts. Next question. Does using the close contact exception require that the individual be participating in an approved screening testing program, as was noted in the IDPH guidance? You know, I'm actually not totally sure if the individual has to be participating or if the screening just has to be taking place in the school setting. If Pollock or Michelle are on this call and you guys know, be sure to pipe in. Otherwise, I will copy this question and get back to you in the next webinar, just to make sure I get it right. All right. Let's see. I understand you are saying you are taking the position of unvaccinated should mask. Is this a Cook County mandate or a strong recommendation? Can you be black and white in your direction? Okay. So,
Lex, this is Deidre. Is Dr. Rubin on? I just want to know if she wanted to address that at all.
Yeah, I'm
you
here.
Can address it.
Yeah,
okay.
I'm here. You know, we're not in a position to enforce, because the Illinois State Board of Education and the IDPH and CDC puts these out as recommendations, and there's not an emergency order that makes these things enforceable. But that being said, we are saying as our most highest level of recommendation that anybody who is unvaccinated should be masked in the schools. Every school district is allowed to make their own decision. But that doesn't mean that that would be considered good public health practice if you chose to make masking optional. When should is mentioned in the CDC guidance, should doesn't mean that it's optional. Should means that this is what we want everybody to do. It's what we think is best public health practice. If a particular school district or school chooses to go even further and to support the American Academy of Pediatrics, which says that everybody is masked in a school, whether they are vaccinated or not, we would certainly support that because it's more stringent. But what we are saying is that at a minimum, the schools, districts should adopt masking for everybody that is not vaccinated.
Wanted you all to hear that. That's from Dr. Rubin. She's our co-lead for the health department. So just wanted to make sure you were hearing it from her and it wasn't like just one of us saying it. So wanted you to hear it from her lips. That's our boss. So just wanted to give her the opportunity to kind of say that because I know this is a hot topic and I know this is a hard decision for schools and I know everyone has thoughts about it, but just wanted to give her that moment to get that in there with regards to these questions, because I know she probably was itching on the other end to jump in. So I wanted to make sure she was part of this
conversation. You guys are doing a great job. And I do want to thank everybody on the call for joining. This is how we get this information across to you and try to address your questions. And we know that there might be some disagreements, but what we're laying out there for you is what we consider good public health practice. And then you take it from there. And we want to help you do the best to keep your schools safe.
Lex, if you want to go ahead, you can. It's up to you.
Right. Thank you so much, Dr. Rubin. That was great. Just going back up to where we left off, can you clarify certain circumstances in the statement from earlier? In certain circumstances, students with no known exposure to COVID can take a rapid test in the nurse's office and return to class if it's negative. I will clarify the certain circumstances as soon as the IDPH guidance comes out, just so that we're all on the same page. So bear with me there. But we will have, it will be specified. Next question, CDC's K-12 exception for close contacts notes that this applies to the indoor classroom setting. With CCDPH's guidance from today, are we able to use this exception for adults? Can it be used for preschoolers? Does the exception apply to locations other than the classroom? Indoor PE, hallways, music, bands. Then in settings where masks would not be worn, such as lunch and outdoors, we need to use the closer than 6 feet definitions of close contact. So yes to the last statement of that, and then for like indoor settings that are not classrooms, like music and band, there will be specific guidance for music and band. For hallways, like for passing periods, you don't really need to worry about that as much. But that IDPH guidance that's specific for music playing, that will be coming out. And you can take a look at that. Hopefully it'll be out next week. That is the goal. Someone asked about the definition of community transmission, and I want to say that CCDPH is in concordance with the CDC's guidance that they put out about what they categorize as community transmission levels. So what is in that CDC guidance is what it is in Suburban Cook. Next question, is there a way to gain vaccination information by age groups in our community? That's a good question. I am not one of the people who works on the vaccination data, but I can ask the person who does and see if that's something that is accessible, but it might be not be, so just keep that in mind. You might need to be gauging for yourself based on gathering the vaccination information from your students, what is going on there. But I'll highlight that to talk to her this week and ask about whether we can have access to that data. Next question, have you heard any updates on when vaccines for under 12 may be coming? In the spring, they were saying maybe in September, but I haven't heard or seen anything since then, and I will just add, same. That's the latest I've heard on it too. I do know that Pfizer is going to be seeking full authorization, not just emergency use authorization. but that's kind of the most recent update I know of for that. So fingers crossed. I know studies have shown that it is still very safe in younger children, but we're still waiting on that approval. Are we able to use antigen testing to return to school if a student has COVID symptoms? I know last school year PCR testing was the recommendation because community transmission levels were high. Right, and the goal there was when community transmissions were low, we would be able to use antigen testing to return to school. So knock on wood, we're staying at our transmission level. I'm not totally optimistic about that, but when transmission levels are low, we should be able to use antigen tests. Are shared materials equipment okay if coupled with proper hand hygiene before and after use? My answer to this is just really do the best you can with shared materials and equipment. When they can be cleaned, make sure they get cleaned. You know, have kids clean off their desk before they come into class. Make sure proper hand hygiene is encouraged and happening. But I do know resources are super limited with lab equipment and shared textbooks. So without burdening the learning process too much, just do the best you can with shared materials. Another question, I've received feedback regarding whether masks are effective at keeping the particle size of the COVID virus from being transmitted. Please comment on whether masks keep out other than N95 are truly protective. Thank you. I guess I'm not totally sure what this question is asking with regards to particle size, but yeah, the cloth masks and surgical masks are still really effective for the aerosolized droplets and regular droplets that contain the COVID virus. They're still really effective. If you go to the CDC's, did I pop the CDC's? Okay, well, I didn't pop it in the chat, but if you Google CDC mask scientific brief, you can see all of those studies that they've cited that addresses that specific thing if you're looking for a specific study on that. All right, I know the definition of should is very confusing, but we're hoping this, along with the press releases going out, makes it very clear that if this masking isn't happening for unvaccinated people at the very least, then that is not following public health guidance. And you're kind of putting yourself in a really difficult position where you're limiting your flexibility in what you can do with your school in terms of mitigation measures. Like, then it becomes really important to be adhering to distancing or making sure you have really good and up-to-date ventilation. So masking is really important in giving you that flexibility to do what you actually want to do in your classrooms. And then, is there any value in continuing temperature taking? Okay, so this was addressed in one of the asked questions. No, you do not have to do that for kids entering school. I mean, if a kid is sick, they should stay home, but you don't have to be having that kind of screening process. CDC says that K-12 close contact exception is for K through 12, so should we expand that to preschool? They also say it excludes adults, but your press release today says adults can use it. Okay, so adhere to our more specific guidance that's in the press release. Usually we'll never go less strict than the CDC, but we might go a little bit more strict because we're such an urban area. So adhere to the press release, and then in regards to preschool, if it doesn't say that in the guidance, then that is not available to preschool at this time. That may be expanded, but it has not been to my knowledge. So Deidre said that we are about to close the chat. If you have any additional questions or you want to tell us that there are certain topics you want us to cover in the coming webinars, like other mitigation measures or when they're appropriate to use, definitely let us know so that we can make sure this is as useful to you as possible. I saw that last question. Screening does not mean close contacts don't have to quarantine. There will be more specific circumstances that IDPH outlines in their FAQs, but blanket sweep, that doesn't mean people don't have to quarantine.
Well, thanks everybody for participating today. Dr. Rubin, I wanted to give you the opportunity if you had anything else you wanted to say before we close the call. And we will be sending out the information about the survey. Please remember that. As well as if you are in any of those communities that I mentioned earlier, please reach out to us so we can work to get vaccination numbers up in those areas. Dr. Rubin?
Yeah, I just wanted to say thanks again to everybody that's participated today. You can certainly continue to send in your questions. There will be more detailed information going forth. We're waiting with bated breath for the FAQs from the state because I think that that will lay out fairly clearly some of these questions. But we're not going to just wait for them. We're going to be proceeding and trying to tackle these major issues, related to testing and guidance related to lunchroom and to outdoor recreational activities, and to go through all of those kinds of topics again, like we did in the spring, but now within the newer context of the latest CDC masking guidance, and also looking obviously at our rates, because you have to know that the highest number of new cases that we're seeing are in the younger age groups. So it's certainly amongst children that cannot be vaccinated yet, as well as in the teens and 20-year-olds and 30-year-olds and earlier 40-year-olds. These are the folks that are not vaccinated, and then these are the folks that are getting COVID. So we do know that for anybody that is eligible to be vaccinated, that is the best way of making our communities safe. And so I would encourage that this kind of a mandate be put in place in your schools, that all staff and anybody that is eligible should be vaccinated. And whatever we can do to help facilitate that for you, we would be happy to help. And so thank you all so much.
All right, thanks everybody, and we'll follow up with the information that was shared today in case folks missed anything. So everybody have a great weekend. Bye-bye.